This is Third Eye Africa TV, exposing crime, savaging the nation.
Hello and welcome to Third Eye Africa TV, and this is our morning show. And today is, should I say, an exciting day, but it's on the low, but a good day, because today we are celebrating the Sickle Cell Day, and this is a day that is recognized globally and celebrated by UN to mark, should I say, to create public awareness on the effort of sickle cell. And in Nigeria has a lot of burden on this SCD, that sickle cell diseases in the country, with over 150,000 children being born annually connected to this disease. So that's why we've brought here today a representative from the Sickle Cell Aid Foundation, Ayobami Bakare. You're very welcome.
Thank you very much.
Welcome to Third Eye Africa TV. So let's dive in. In simple terms, what can you define as sickle cell?
So without too much ado, sickle cell is basically when two couples with the S gene get married. So the X gene can be AS, SS, and the likes. So when you have two AS get married and they have kids, for every birth, there's a 25% chances of having a child with sickle cell. So the sickle cell gene is called the SS genotype. Right? Yeah, it's called the SS genotype now. So for every birth, there's a 25% chances. And so I would say we got the maths wrong for a long time. Yeah, because people would say like, oh, if you start to worry around like your third child or your fourth child, the odds for those that play sports, the odds are like for every birth, there's a 25% chances. And that 25% chances cannot be predetermined. So it happens
anytime. Yeah. It could be any child. It could be the first child.
It could be the first. It could be the first. It could be the last. So there's no order to it.
Oh, no. Now, in Nigeria, we've heard that the statistics is like 150 children being born with this disease. Why is this so in Nigeria?
So the number is actually 150,000 births.
50,000, yes.
Yeah. So we are the sickle cell capital of the world.
Interesting. That's Nigeria. That's sad.
Yeah. So I think it's going to be due to a lot of, let's say, environmental factors also. And because you know that the AS gene came as a result of the body trying to fight malaria. So it's not, normal gene would have been just AA, but evolution and the body trying to create started with the AS. So from AS, that's where you now have like, okay, when two AS get married, then you have SS, then you have SC, and so on and so on.
So you're saying in Nigeria, there are a lot of AS in Nigeria?
Yeah.
Oh, compared to other countries. But I would also like to point to this aspect that I was trying to tell you this before, we started rolling. Before now, our forefather, our parents, they had this incident of sickle cell disease and all that, and it wasn't tagged as sickle cell. They were just like, oh, in some part of the country, they say, oh, this child is suffering from what they term obanje or something, or one sickness, or that they tagged traditionally, and they tackle this traditionally. But now we're seeing a different growth in that compared to before. Why is that? Are people still ignorantly marrying AS and AS?
Okay, so your question is two-pronged, so I'm going to deal with one after the other. But the issue with, in the olden days and everything, I feel like there were not lots of information available at that point. And interesting fact is, like, if you speak to older generations, there were a lot of prepubescent deaths in children, like a lot of children die. In fact, mortality rate was very, very high. So according to their own understanding, a lot of reasons were ascribed. And Ogbanje was one of the many reasons. So child that just came to
take the family's wealth
and keep coming and keep going back. But we don't have enough information to say, okay, this was the problem. And as we can't push it aside, sickle cell might be one of the major issues then. So until the knowledge now became available and people knew, okay, this is what causes sickle cell. You are AA, you are AS, and so this is where now we now start tackling the issue. And sadly to say, I would say people still decide
to marry AS.
And like two AS can still decide to marry, in this present still decide to marry. And if they place a lot of reasons. Most might be community, most might be religion, and they tell you like, oh, my like they don't believe sickle cell will do anything. And to those people, what I tell them is, love conquers all things, but it doesn't conquer sickle cell.
Interesting.
It doesn't. Like, there is love and there's sickle cell, and you would know.
You would have to deal with it.
You will have to deal with it. And let's hope that love is enough
to hold when the sickle cell
because
comes in.
Aside from the child that maybe probably would have routine visit to the hospitals and everything, you are going to spend a lot of money. You are going to be stressed. Like, everybody around is going to be stressed. So, like, sickle cell, it's something that affects everybody. But we are saying, like, for the sake of the children, why go into it in the first place? Like, why put on that person through a pain that you most likely would never feel?
Very interesting. That brings me to the next question. What do you think is like the largest or the biggest challenges the patients now themselves have, especially in Nigeria, looking at the environment?
So our health system is actually one of the major challenges because just like every other thing, sickle cell also evolves. Like, our treatment hasn't really evolved as much. So we need like a lot of people going into like a lot of professionals, like to deal with pain, blood transfusion, new sickle cell treatments, like what needs to be done, so that people living with sickle cell can get better health and better management.
Now that brings me to the next question, where I want to know your foundation, that's the Sickle Cell Aid Foundation. How have they played a role in ensuring that this whole sickle cell, the challenges the patients themselves face, the family, the community, the society, like you said, it's not just the person that faced this problem, it's like every other person. How have your foundation helped in solving this problem? Okay,
so the Sickle Cell Aid Foundation is a youth-led organization. The word youth now might be exaggerating a bit because like maybe we're all on our way to 40s and everything, so I'm not sure if we're still youth, but we started as a youth-led organization. And so one advantage we had was that we are not coming from the medical aspect. Like everything. Like, people around us had sickle cell, friends had sickle cell. So we were able to witness firsthand their experiences, and that's tailored the way we dealt with every other enrollees we've had over the time. Because even though not all of us could speak to the pain, but we've had friends, we've had family members with sickle cell. So we're able to like, okay, so this and this and these are what the gaps we've seen. And those are the gaps we've tried to feel like, okay, we created a community of support for people living with sickle cell. We created a beneficiary friendship program where like all of our volunteers are paired with people living with sickle cell, so that sometimes if someone living with sickle cell, we call them warriors. All warriors need someone to advocate for them. So sometimes it's not every time that we have to do money or most time we just advocate for them. Like, okay, this person has been in the hospital for so long, this and this and this are the symptoms they came with. Like, what is the next line of treatment? This is not working. What next are we going to do? So we created advocacy groups. We created sickle cell club schemes in secondary schools around Abuja and Kano. So because we now realize that sometimes by the time they get to the university, the messages are starting to come a bit late. So like we're trying to do like a catch them. Early knowledge. Like, okay, so we are not telling you are getting married next year, but we're telling you like in the future, when it is time these are the questions you need to ask. And one of the questions is, are you my type? What is your genotype?
I think talking about marriage now and early knowledge on marriage, how important is genotype when it comes to marriage?
So my go-to formula is this. if you are not AA, do yourself a favor and marry AA. This does not confer on people with AA genotype any special abilities, like I would like to point out that. But for the sake of children, unborn children, for the sake of the society, and like the long, I'm going to put it, okay, I think I don't have words for that now. But if you're not AA, marry someone that's AA. It is very, very vital. Like, love, and some people believe, oh, we can pray it away. Like, sometimes you might not be able to. I believe in miracles just like the other person, but I've seen sickle cell patients pray. Like, so why not concentrate that prayer on something else? Like, there's a lot going on with life that you want to now have one prayer point for the rest of your life.
But you know, sometimes they say it's too late when, especially when the information is coming very late, you already found yourself in love with this person, and voila, it's ASAS.
Okay, so this might sound a bit controversial. First and foremost, I don't believe there's one person.
Yeah, for everyone.
I don't believe like there's A was created for B
as the Mr. Right,
the Mr. Right or Mrs. Right and everything. There are 7 billion people or maybe 8 or 9 billion people in the world. Like, there are a lot of rights. So, and it's amazing how people with AS always seems to find people with AS. And I'm like, how do you find each other? This is supposed to be like 25% of the population. How is that the so-called 25% of the
are finding
each other and leaving the other 70% out? Like, AH should be between 60 to 70%, while AS should be like maybe around 20 to 25%. So how are these 20 to 25% keep finding each other, like, and keep excluding the 70%? So I tell people, like, see, just, it's never too late. Like, people like, oh, what if we're already married and everything? Like, okay, if you're already married, I think there are like other options you might want to look at. You might look at IVF, gene selection, like all those things. Those are options. But if you can afford it, because those things don't come cheap also.
So you've spoken about advocacy, and now you're talking about IVF and the rest. What medical assessment or medical facilities are accessible to sickle cell patients in Nigeria? Looking at, I like to specify looking at Nigeria, looking at the environment.
Looking at Nigeria, so one of the things people living with sickle cell need is they do a big part of their treatment is blood transfusion. And when they need to do blood exchange, that becomes a bit dicey, because I feel like in Abuja now, I think it's the National Hospital that does blood exchange in the whole of Abuja. So maybe you have like at most 5 centers or so that does blood exchange.
That's poor.
So that is poor. So like now you're looking at 4 million people to 5 facilities. Then the center in Benin started bone marrow transplants. I've tried to ask a couple of questions if that is still going on, but nobody has been able to give me a definite yes or no. But I know a few years back, way before COVID, they were running bone marrow transplants in Nigeria. But outside of the country, like India does gene therapy, bone marrow transplants. So, but still, those come at very, very steep prices.
I would want to ask one question now. Bringing it to rural environment, how do you think they cope, and what are there medical facilities, or how do they assess medical care in rural communities?
So that is a very, very hard question. But luckily, because it is hard to find a medical practitioner that's not heard of sickle cell in one way or another. I'm not saying they are not. And so basically, a lot of sickle cell treatments, except when you now have like special cases or something, like most rural community health centers and everything are still able to deal with it.
Okay. I would like to also ask, for your organization, for your foundation, do you have like government support, and how can the government support foundations like yours and other foundations, other communities in fight against sickle cell, or in creating public awareness to fight sickle cell diseases?
One of the things we've been at the forefront advocating for has been a sickle cell management bill. So I think I missed whether the Fourth Republic or something. We've had a couple of bills, but they've never scaled into being passed into law. So those are one of the things. Another ways the government could help is subsidizing sickle cell treatments.
Interesting.
Because like some other people are able to get, but for sickle cell people, for warriors, we've not been able to get that concession. Like maybe a couple of states, Lagos State offers like certain treatment, but sometimes even those treatments are very expensive. Like there are a lot of complications that comes with sickle cell. Sickle cell literally affects every part of the body. So whatever it is you can think, whatever it may affect any part of the body can affect a person living with sickle cell. So like those things are very, very, cost a lot of money. And we're hoping like there's something in place or something, maybe an insurance scheme that covers people living with sickle cell. It will go a long way.
Interesting. I like the fact that you brought that subsidy there and then the policy, the bill. Very interesting. I mean, you guys you're heading somewhere. Okay, back to your organization or your foundation. This year, what are we planning? What are we doing to commemorate this year's Sickle Cell Awareness Day?
Okay, so part of our commemoration is advocacy, which I'm doing here with you, getting the word out. But for the major activity we're having is that's on the 21st, which is a Saturday. We're having a Warriors Hangout where we bring people living with sickle cell, both enrollees and non-enrollees, like people we know around. Just it's a social day basically, like where we just sit down, talk, exchange stories, talk about what life has been in the last 1 year from the last Sickle Cell Day. What are the challenges? Do other people is there another person going through the same? Can they offer advice? And probably talk to doctors also.
Very interesting. So you're creating a social space for them. So it's not like you're in this alone, you fight your battles alone.
So that's what we're trying to just strengthen the community as it is.
Very interesting. I mean, you guys are doing advocacy, medical, social, everything. That's very interesting. Okay, one last word I would want you to put here is, now we've talked about your organization, we've talked about the government. How can parents, how can children, how can communities, how can the media, how can every single person partner together to create this awareness to fight sickle cell diseases in Nigeria?
Yeah, I think the first line of defense is actually asking the question, like asking friends and families, do you know your genotype? Because for something that happens, like maybe at least 40 to 50% of Nigerians have come across people exhibiting symptoms to sickle cell or something. A lot of people don't know their genotypes. And it's not like, oh, my mother told me I am, my father told me, like, go
and do it yourself.
Go and do it yourself and get the result. And if you have conflicting results, then you go to another center, like a proper standard center, and have it done so that you have one result that you know it is correct and that is your genotype. I feel like that is the first line. Our second line is as much as possible, like contribute to the conversation, like see if they volunteer activities and also donate blood. Yeah, because like people living with sickle cell, like the warriors do a lot of transfusions and everything. So week in, week out, we've had to call people like, oh, please, could you be able to donate blood? Would you like to donate blood? Would you go and donate blood if you? So those are the things I feel like everybody can chip in.
Very interesting. I don't know why I'm amazed by this whole contribution, but if you would have asked me, how would I have come in to help? I would have said, oh, just donate some money. But now you brought it down to the donation of blood, which is really, really vital in the fight against, their battle. Thank you so much, Ayomide.
Ayobami.
I said I will not spoil someone's name, but I did it. Bakari, you're very well. Thank you very much.
Thank you very much for having me.
Thank you so much for joining us here
in
Third Eye Africa TV. It's such a wonderful day. And to our audience, to our viewers, sickle cell disease it's not something that is sidelined. It's something that should be created more and more and more of awareness. And we are asking that in this day of advocacy for these people for sickle cell disease. We're asking for your support to the advocacy against sickle cell disease. Thank you so much for joining Third Eye Africa TV. My name is Juliet Onra. Bye for now.
This is Third Eye Africa TV, exposing crime, savaging the nation.